Okay, so last week we talked about your job, and I was just wondering how you were doing your job this week.
I mean, it was pretty much the same. It's so frustrating because so I'm a CNA at Yale New Haven, and I'm on an observation floor. So patients who are discharged from the ER but aren't necessarily ready to go home yet or aren't necessarily ready to be admitted into the hospital come to our floor for 24 to 72 hours just for further observation, really. A variety of patients come through, whether it's, the elderly or younger patients. We get a lot of chest pain because, necessarily they may not need to be admitted, but they can't really just send them home just as a liability. So we do get a wide variety of patients, but, there's 22 patients on the floor, and there's 2 techs, which is what I am, and then 5 to 6 nurses on a good staffing day. So I get 11 patients and the other tech gets 11 patients. But if there's been many occasions where I've been the only tech. So I have 22 patients that I need to round on every hour, do vital signs every 4 hours because they're on heart monitors. So it's a lot for one person.
Of course, yeah.
And some of the RNs are really good about helping out, but most aren't. And they're like, well, it's your job, so figure it out. And I'm like, I can only do so much. I am only one person.
Yeah.
And whether it's an 8-hour shift or a 12-hour shift, that's a long time. And I want to, do everything that I can. And I, necessarily don't want to ask for help because I don't want to seem like incompetent. But I want to, I can only do so much, and it's exhausting.
Yeah.
I go home and I'm exhausted.
Yeah.
So, I don't know. I'm in nursing school also, so obviously nursing is, my passion. It's what I want to do with my life, and, the experience is amazing. But I've reached a point where I'm not learning anything. It's, they wake up, we do bed baths or showers, I help set them up for breakfast, vital signs, the occasional EKG, but it's nothing exciting, it's nothing new, it's nothing I haven't seen or done before, so I've kind of plateaued to the point where there's nothing more I'm getting from it.
So at first you're feeling very stressed out because you're the only one working. So I can see how that's stressful. And you also say that it's like you don't want to ask for help and you want to be the best that you can be, but everybody wants to be the best they can be, but it's not really realistic.
You're right.
So I wouldn't stress yourself out about it too much. I mean, even though you're not really learning from it, do you still like your job? Do you feel that like you're being paid enough to continue this, or you're not interested in continuing?
I mean, the pay is good. It's better than minimum wage, and it's, I've been there for 2 years, so I'm still kind of bottom on the totem pole, but I'm still accruing, what's the word? Like status, like I'm not the bottom, but I'm not even close to the top. So the pay is not really an issue. It's more that, I don't know, I'm the type of person that learns by being exposed to certain things.
By being challenged.
Right. And I love to, watch the RNs and see what they're doing and, learn from that. And again, most of them on the floor are great and I really like them, but there's a good handful that have no desire to teach me, which is frustrating because if I was in their position, I would be more than happy to teach an aspiring nurse. And I don't know if they have an issue with me per se, or if it's just they don't like the techs, but I go above and beyond to help them and make their jobs easier. So I guess I'm just looking for a little respect. And I don't know if respect is even the right word, but it's just common courtesy. I do whatever I can to make your job easier. So if, pull me into, doing an IV or something to show me, that's all I'm asking. So I don't think that's a lot, but.
Do you think that there was an issue maybe in the past that could have affected that?
So I came in per diem status, which is, it's not part-time, but you have to work 24 hours a month, which is all I could do with school, because I do live up here and I have to go home to commute to the hospital. So I don't know if they were looking to have me more, but they hired me per diem, so that's what I'm doing. And unfortunately, I had to have ankle surgery, which put me out for almost a year. So I don't know if they were holding a grudge over me for that, but it was one of those things that was like out of my control. I hadn't,
Of course,
if I, could have avoided it, I would have been happy to. But I don't know if that's one of the things that they were like, well, she's obviously not, putting in 100% and she's not worth our time. And that's frustrating to me because I was doing everything I could to get back. And I don't know if they just, I don't know if they felt like I was, coming into their little family and they weren't happy about that, which I get. But I've been there for almost 3 years, and it would have been nice to be welcomed a little more.
Yeah, I can see how that's frustrating. I mean, you didn't do anything to harm anybody or purposely
hurt
yourself, therefore there shouldn't be really a problem. But do you think that, like, you could confront them about it, or is it something that's not even confrontational?
I mean, I don't even know what good it would do. I mean, there's like nurse managers, and they're kind of in charge of the floor. And one of them I have a really good relationship with, but the other one is very condescending. And it amazes me that she's a nurse, because she's just the bedside manner. And, I'm like 2 months post-op from a bone transplant, and they're expecting me to be back to work. I'm like, I'm not even allowed to walk.
Yeah.
What do you want? Like, it just amazes me at some of these people. So I don't even know if it's worth it. And I'm, as much as I want to be there and be devoted to this floor, there's a part of me that it's like, maybe I should leave or find something else that maybe challenges me a little more. But then it's like, at the same time, do I want to leave the seniority that I have? I don't know.
Do you think that it would be a good choice? Like, do you think that other places would challenge you more and teach you more? Or do you think that staying here is a better option for you?
I mean, I would, there's so much more I want to do, and observation is not the specialty I'm looking to go into, so I would love to, but I guess I'm just afraid that the same thing is going to happen when I get to this new floor. Like, is it worth it to leave? I know all these people, like it makes me almost anxious thinking about going to a new place and having to meet new people and learn a new routine, because depending on the floor, it may be a whole new variation of tasks that I'm with, and it may be more high-risk patients, and it may still just be me, and that makes me nervous, because I, God forbid, if I can't get to something because I'm the only one on staff, that makes me nervous, and I would never want that to affect a patient.
Well, speaking of nervous, last week I made you fill out this patient health questionnaire, and I see that you checked off that in the last 4 weeks you've had an anxiety attack. Was that at work?
Yeah, I was also by myself, and there were 22 patients on, so we had a full house, and they were so a patient can either be complete, independent, or partial, and I had 8 complete patients, which means they need complete care. They're, incapable of doing a lot of things on their own. So, they need a total bed bath. They need, sometimes they need to be fed. So it's so much for one person. And I just got so anxious because I was not staffed with the best nurses, and they weren't even remotely helping me out. And I just felt so overwhelmed. I had to take my 15-minute break and
I can see how that
freak
can be
out.
Extremely stressful. But you also checked off. I asked you, has this ever happened before? And you said no. So it's only occurred at work, correct?
Yeah, I think it's a work-related thing, which is, should I be in a job that causes me so much anxiety? No.
Yeah, exactly.
But again, I'm afraid to leave.
So that's something you have to consider, that, well, you're having anxiety attacks, so is this still the right choice for you? You also checked off that you were short of breath and your heart was racing, your heart was pounding, or it skipped a beat even. You have chest pain, pressure, you sweat, you felt like you were choking, you had hot flashes and chills. Like, these are all things you have to consider while working. I mean, I can imagine how frustrating that and stressful that is, so you have to consider that while thinking, yes, I love my job and everything, but all these are not good for me, or not good for my mental state, so therefore, do you think I should leave? So I think you need to think that through, and maybe make a pro-con list of maybe the good part about this job, the not so good part about leaving, and I think you should think that through.
Yeah, I mean, it's definitely, I think it's definitely getting to that point where it's really time to consider transferring to a new floor. Because I think as anxious as I get thinking about leaving what I'm so comfortable with, I think a change might be good. I mean, all floors can't be that bad, right? So I'm thinking that, you know, the more we sit here and talk about it, that might be the best thing for me.
You've also said that you felt like you were afraid of dying, therefore, but you're working at a hospital, you said, so it's like, you know what I mean? Like, it's kind of like, like, you feel like you're dying, you're working with patients, it's not really the best atmosphere.
Right, so that, I mean, that's a lot that I really have to consider and figure out. And, I mean, that's probably something we should discuss next week, because I mean, it's a lot, and I really have to, I think making a pros and cons list would be really good.
Yeah,
just trying to figure out.
So next week we can work on that. I do want you to make a pro and cons list, you know, whatever, saying what are the pro and cons of this job, but also if I have a new job, maybe start applying places, talking to them, seeing what options are out there for you, and seeing if you will be challenged and will be learning more from other places.
Definitely.
So we'll talk about that next week.
Perfect. Thank you.